Surgery, where life and death hang in the balance, depending largely on the skills of the dedicated men and women who each day apply those skills that others may live. Depending, too, on the efforts put forth by the housekeeping department and surgical nursing staff to maintain an infection-free environment. Here, the danger of cross-infection is perhaps more critical than in any other area of the hospital. Its prevention, by consistent use of appropriate sanitation procedures, is the subject of this program. The procedures you will see here will be performed by housekeeping, by surgical nursing, or may be shared responsibilities, depending on the policies of each facility. To those involved, OR sanitation must be looked upon as a function vital to the protection of life, both the patients and those who treat them. A most important ingredient in all OR cleaning is a germicidal cleaning agent which has been approved by the Infectious Control Committee, the surgical nursing staff, or both. Always mix this cleaner exactly according to the directions. This will provide the desired results while leaving no residues on the surfaces cleaned. Using too much will not make it more effective, but will create more work for you. The surgical nursing staff is fully instructed in and responsible for OR sanitation before and during surgery. The day begins before the first surgery is performed with the damp dusting of all horizontal surfaces such as tables, lamps, and equipment including that which is mounted on the walls or overhead. All should be dusted with a damp cloth or dampened high dusting tool. The cleaning agent used will be a germicidal solution mixed as shown a few moments ago. Notice that in preparation for surgery, all personnel are wearing garments appropriate for the operating room. These include head covers, face masks, shoe covers, and rubber gloves. Surgical gowns are worn by those who will come in direct contact with the patient during the procedure. The need for sanitation intensifies during surgical procedures, requiring consistent and deliberate action by the OR staff directed at confinement of contamination. Spilled organic debris is a common cause of dispersal of potential contaminants and should be removed immediately. Use the approved germicidal agent for this purpose. This may be applied with a spray bottle, or the spill can be removed with cloths which have been saturated with germicidal solution. All items used in connection with the surgical procedure must be considered contaminated and require containment, either in an appropriate receptacle to await sterilization or in a designated disposal unit. Sponges, for example, which should be counted as circumstances permit, are to be discarded in impervious containers. Instruments and other equipment used in the procedure should be held within an area of close proximity to the patient where this is possible, to reduce the danger of cross-contamination until they can be removed for sterilization. Upon completion of a surgical procedure, wet drapes are removed and placed in a laundry hamper. Where fabric laundry bags are used, the drapes should be placed in the center of the bag to inhibit soaking through to the outside. Gowns are removed, turned inside out, and immediately placed in the hamper. Rubber gloves should be turned inside out before disposal in the trash container. All disposables are deposited into impervious bags for later disposal according to hospital policy. Dispose of suction contents into a flushing hopper. Rinse glass suction containers prior to sterilization. Disposable containers should be sealed before depositing in a trash receptacle. Finally, all remaining equipment, tables, lights, and other objects within the room are damp dusted just as was done at the start of the day. When all equipment has been cleaned or disposed of, the floor should be flooded with the prescribed germicidal solution. Roll wheeled equipment through the solution to disinfect the casters. Use a wet vacuum, if available, to pick up the solution. A clean wet mop can be used as an alternate method of recovery. After the final surgical procedure of the day, terminal cleaning, the overall major cleaning of the OR and equipment, can begin. Airborne bacteria are major culprits in causing post-operative infections, so it is most important to clean overhead equipment and lights. Use a damp dusting cloth which has been dampened with a germicidal cleaning solution for this purpose. This should be done before cleaning any lower-level surfaces to prevent contaminants from falling onto already clean equipment. The approved germicidal agent must be used for all cleaning procedures. Every piece of equipment in the room should be thoroughly scrubbed with this germicide, and plenty of good, old-fashioned elbow grease. A lick and a promise just won't do the job. Wheels and casters must also be cleaned and carefully inspected. Surgical thread has a way of getting caught around the axles and must be removed. After scrubbing has been completed, rinse with the same solution, allowing it to air dry to provide the maximum benefits from the germicide. Kick pails should be sterilized if the necessary equipment is available. Where this cannot be done, these containers should be carefully and thoroughly scrubbed and disinfected. Once again, rinse with the germicidal solution and allow it to air dry. The doors of cabinets, especially around the handles, require daily attention, since they may be used several times during a day of surgical procedures. Entrance doors, too, must be thoroughly washed and disinfected daily. The kick plates certainly need constant attention and may require the use of some type of scrub pad to do the job right. Effective cleaning and disinfecting of the OR floor can be achieved only by flooding the floor with a germicide solution. The method used for flooding will vary from one hospital to another. A clean mop head may be used, or a scrub machine with a dispensing tank. While the floor is flooded, roll all mobile equipment through the germicide so as to disinfect wheels and casters. Move all mobile equipment to one side of the room to make cleaning easier. Cleaning can be accomplished with the scrub machine or with the wet mop, but a clean mop head must be used for each surgical room. After cleaning, the solution may be picked up with a wet pickup vacuum or with the wet mop. When cleaning has been completed, return all OR equipment to its proper location. Before leaving the operating room, gowns and gloves should be removed, turned inside out, and placed in the appropriate receptacle. A clean gown and gloves may be required in each surgical suite. Wet foot covers should be replaced immediately. The scrub sink area may be included in your area of responsibility and is likely to require cleaning more than once daily. Once again, the germicidal cleaner will be used. Begin by cleaning and refilling the soap dispenser. If disposable cartridges are in use, simply install refills where necessary. Refill brush and nail cleaner dispensers, removing used items for sterilization. If disposable brushes or nail cleaners are used, discard them in the appropriate waste container. Scrub the inside of the sink and the faucet, the wall area around it, the outside surfaces, the underside, and the pipes below. Then rinse the entire sink, faucets, wall, and pipes with more germicide solution. Finally, flood clean the floor just as was done in the OR room. Certain parts of the surgical suite will not require overall cleaning on a daily basis, but will usually be done on a regular schedule. High dusting of ventilator grills, overhead tracks, and other non-critical areas is one example. These should be done faithfully on a prescribed schedule. Neglect can readily turn them into critical areas. Use the high dusting mop, dampened with germicidal solution, to perform this task. Wall washing is another periodic procedure. As is always true when working in surgery, protective clothing is worn while washing the walls, and the ever-present germicidal cleaning solution is used. The wall washing tool may vary from one facility to another, but most will have such a tool to make it possible to accomplish the job without a ladder. Notice that the washing is done from the bottom up. This is a standard rule for wall cleaning since it prevents streaking. Use plenty of cleaning solution. There will be no rinsing done. The walls will dry without streaks if the procedure is correctly followed. Yet another periodic procedure is cleaning the inside of OR cabinets using clean wiping cloths and germicidal solution. An often ignored but most important sanitation project is the periodic cleaning on a prescribed schedule of sterilization equipment. Follow the recommendations of the manufacturer of the equipment using the designated materials and procedures. In addition to the surgery and scrub rooms, the corridor requires daily care and should be treated as though it were a part of the OR itself. Requirements may vary somewhat depending on staff decisions, but the prescribed tasks should be consistently performed. Among the special project areas, you will find offices, lounges, and locker rooms. These too should be cared for using the methods prescribed by the surgical staff. All of these OR sanitation procedures can be divided into 6 specific categories. Pre-surgery, which requires damp dusting of all horizontal surfaces using the approved cleaning agent. During surgery, which includes proper protective clothing, containment and handling of instruments, sponges, and other equipment, and immediate attention to organic spills. Between surgical procedures, when damp dusting is repeated, the floor is flood cleaned, all mobile equipment is rolled through the germicidal solution on the floor, and instruments are sterilized. Terminal cleaning, after the day's final surgical procedure, when all equipment which cannot be sterilized is scrubbed with germicide solution, the floor is flood mopped or machine scrubbed, and all mobile equipment is rolled through the solution to disinfect casters. Scrub room and corridor cleaning, again using the germicide solution to clean scrub sinks and mop or scrub the floor. Dispensers for soap, brushes, towels, and other supplies are filled or replaced as needed. And periodic cleaning, which includes high dusting and wall washing in the OR room, cleaning sterilizers, and special projects such as office, lounge, and locker room care. There are 2 all-important steps which should conclude any cleaning task, and their importance should not be ignored. All of the equipment used for cleaning must be scrubbed with a germicidal solution and properly stored in the designated area, ready for use the following day. Cleaning cloths and soiled mop heads should be deposited in the appropriate receptacle for transport to the laundry. And finally, spend a valuable and health-protecting few minutes at the sink. Use the provided antiseptic hand cleaner and a hand brush to assure that all possible contaminants are eliminated. In this way, you will protect not only others, but yourself as well. Do not neglect to wash your hands, preferably several times daily. Your life could depend on it. The importance of sanitation in the surgical suite cannot be overstated. The job you do here makes a major contribution to sending patients on to a healthier, happier future. When you know the job has been done right, there is every reason to take pride in your contributions to the health and welfare of all who enter this facility.